Hi, now I'd like to explain to you the FADER test, which stands for flexion, adduction and internal rotation, and we use this test to test for pathology within the hip such as osteoarthritis, a cam and pincer impingement or perhaps a labral tear. So in order to execute this test correctly and test for any pathologies within the hip, what I'll do is, it's a passive test. I lift the patient's hip and I will passively flex the hip maximally and introduce internal rotation like this, right across the body and down. And a positive test in this will be generally pain within the inguinal area in where the ball and socket joint is or the coxofemoral joint is. That often can indicate cam and pincer impingement, where you have a cam deformity on the ball or a pincer off the socket, off the edge of the socket, or perhaps a labral tear, or in somebody who has osteoarthritis, this will also induce pain. With somebody who has a cam and pincer impingement, what you generally feel is when you get up here, what you should have is a nice elliptical or circular type smooth motion in a healthy hip, and in a hip that has pathology and something like cam and pincer, as you get up here, it's like a doorstop almost, comes up in a half circular motion and almost stops, and you have to come straight down, and obviously the elicitation of pain. So that, everybody, is the FADER test to diagnose impingement of the hip and also obviously multiple pathologies within the hip.